Hello, good day to you. My name is Godfrey Mushandu from Care Quality Support and Outright Healthcare Solution, a healthcare consultants provider based in England, working with health and social care providers around the UK. Welcome yet again to our leadership and management program for the health and social care sector. We regularly produce information to share with our members in our various platforms. Last time, we discussed about things that leaders need to be on top of in order to succeed as leaders within the health and social care sector. We talked about good leaders having a perspective of what they are doing and also having empathy. Today, I'm going to be talking about the basic requirements of an effective leader in health and social care sector. And one of the most important things we need really to understand is I have been talking about the definition of leadership and a leader. There is no one single universally accepted definition of leadership, but there are a number of combination of statements which when combined would reflect what a leader is. So within the health and social care sector, we need to be effective leaders. But how does one become an effective leader, you may ask? Before you become an effective leader in any field, you need to have sufficient knowledge of that subject and field you are dealing about. But today, we are talking about sufficiency in knowledge within the health and social care sector. You might have universal knowledge in the different divisions of health and social care sector, or you might have sufficient knowledge in one specific sector. This may be domiciliary care agency, supported living for adults, children's homes, supported accommodation for young people 16 to 17, or care employment agency, either temporary or permanent. Or of late, we are seeing an expansion of up and coming new providers within the non-emergency transport service. However, what I want to emphasize here is knowledge on its own per se is not enough, and it does not translate into effective leadership. There are a lot of people with health and social care knowledge who are very bad at leading. So, you may ask again, Godfrey, what is it that can be referred to as attributes and broad attributes for being an effective leader? There are three main broad categories that are needed for one to be an effective leader within the health and social care sector. Number one, right personal attributes. You need to have right personal attributes as an individual within the health and social care sector. These attributes are the ability to set your objective, set plans, and you stick to them. Where do these objectives occur? The objectives are derived within your statement of purpose and your business plan. So if you are an effective leader, you will be able to set these objectives, stick to them, adjust where possible or where necessary. So those personal attributes can always be learned. You can't inherit them. You cannot never be born naturally with them. So, as I said, a brain is a muscle. It can be flexed. So in order to increase your attributes, you need to be exposed to how these processes are designed, How do you compose a statement of purpose? How do you compose a business plan? What do you need to include in a business plan? When you are setting your objectives, how practical are they? How are the deliverables? What structures do you have to deliver those objectives? So those personal attributes will work towards making an effective organization with effective leadership. So you need to be able to lead very well, consistently, and the attribute which we talked about last time under empathy and perspective, it also comes as a personal attribute where an individual leader has to put people at the center. You should be a people matter leader where your people who are your staff are at the center and at the core of your objectives, having the ability to learn, to release, and also be able to make sure your staff are supported to be able to understand and deliver those objectives. Number 2, an effective leader has got the ability to motivate. So ability to motivate is to take your staff from a low level of perception to a higher level, working with you. Just like in the military, there are people who are motivated to the point that they are prepared to die for their country. This is where motivation comes in. Within the health and social care sector, an effective leader will transport their staff with them from one level to another. Ability to train them, to uplift them, and to develop them as individuals so that they can see where they are going. It is highly understood that the health and social care sector is highly regulated. Therefore, people tend to shun away from responsibility because of the implication of doing things wrong. But if you are an effective leader, you will be able to reassure your staff, to show them the direction where the organization is going and what is in it for them. We will continue and explore this particular subject of motivation because it is a broad subject that we cannot just talk and finish today. Number 3, an effective leader needs to have the ability to create and maintain a team. The ability to maintain a team is bestowed upon effective leaders, where within the health and social care sector, you identify various components which make a team. Just like in any sport and football, you have got a goalkeeper, you have got a defender, you have got a midfielder, a winger, a striker. All those combine to be effective teams, and they succeed because people are playing on positions where they have been trained, tested, and supported to develop. So if you are a leader in the health and social care sector, identify your sector. If you are in the dom care, you have to understand you have got management, you have got care coordinators, you have got team leaders, or you have got your care and support workers. So your ability to have this work as a well-oiled machine, where the coordinator is in the office and in the field, supporting those in the field, and the coordinator supporting those in management, looking at the rota, looking at the attendance, looking at what you call the runs in supported living, in domiciliary care. So that team then can work together. Similarly, within the children, supported accommodation, supported living, care agency, non-emergency transport service, you still need to have a core team whereby you pass the ball from the back to the defenders, to the midfielder, and eventually to the strikers, and you will score. So if you are a leader, you need to be able to communicate, to delegate, and to appraise. If this is achieved, you then become an effective leader. The above 3 skills which I've talked about, right personal attributes, ability to motivate, ability to create a team within the health and social care sector, they will then work towards creating an effective leader. I'm sure as an effective leader, your communication and ability to create a team does not just stop internally. You work with the Department of Health, NHS, private sector, social workers, GPs, pharmacists, radiographers. All those are people whom you need to bring together, being able to coordinate and knowing how best you can deliver a service. With the coming of artificial intelligence and digitalization which is coming, you also will be working with companies which might be providing you with the necessary electronic co-monitoring and management systems. If you are running the transport division, you will also be talking to your drivers. You will also be talking to the radio operators. So this communication and ability to lead a team, giving them defined jobs, allowing them to work, let them make mistakes and you correct them, rather than bulldozing and making decisions on behalf of all your staff. I hope this series will lead you somewhere. I will conclude by saying effective leadership on its own is a subject which anyone who is committed can learn. My name is Godfrey Mshandu. We are here to create effective leaders, to create leaders who will deliver in line with the quality standards for Care Quality Commission as well as Ofsted. I hope as we continue to listen and as you continue to attend some of our lessons and some of our training, we will turn around those who are still new so that they have good, effective leadership. Those who are already in leadership, we still welcome you so that you refresh your skills, you know new knowledges, new strategies, and new ways of supporting your organization. My name is Godfrey Mshandu, Care Quality Support and Outry Healthcare Solutions. I sign off. Thank you very much.